Good morning, everybody. Actually, good afternoon. This is Massimo Buonomo, United Nations Global Expert in Blockchain, Cryptocurrencies, Fintech, Blockchain Solutions to COVID-19 Challenges. Let's do this presentation about these series issues. A little bit talking about myself first. This is me. I am a United Nations global expert in blockchain, cryptocurrencies, fintech, green tech, and regtech. But nowadays, I'm currently focusing on blockchain solutions to COVID-19 problems for governments and companies. This is an issue that is very important. It's been there are lots of talks about that, and we're gonna focus on the main issues. I am also international consultant on blockchain issues. I am a university professional of fintech and international finance. In the past, I worked as a senior European equity bank analyst. I was one of the top rated bank analysts in the city of London. I'm fluent in Italian, English, and Portuguese. I lived in Europe, China, USA, and South America. Now, I focus my consulting services for international organizations and corporates on blockchain issues related to supply chain and COVID-19, cryptocurrencies, and any other related issue. I also give valuable training sessions on a one-to-many basis for clients, and also limited space support webinars where common issues are solved. And I deal with as many specific issues as possible. You can see some of the international conferences where I was a keynote speaker: London Blockchain Summit in London, in Paris, in Dubai, in London again, on supply chain unblocked specifically. So I have a little bit of experience about the applications of blockchain to several sectors. But now this is a summary of the presentation that I'm going to make. And also, I want to get you through the main topics of COVID-19, because there has been a lot of discussions nowadays on what the pandemic is, but I don't really believe that there is a clear understanding of the problems, the main challenges, the health variables that have to be monitored to delay a potential second wave. The second wave issue is the most important issue, especially for Europe, while in in United States and Brazil, we are still, unfortunately, in the first wave, or we are ending the first wave probably in United States. There is a different issue that I'm going to deal with, the economic growth after COVID-19. That is a very important issue. And also, then we're going to get to blockchain solutions for COVID-19 outbreak. And we're going to go through several use cases. And we're going to see there are several use cases around and several applications, blockchain applications to COVID-19 challenges. Hopefully, at the end of this long discussion, I hope to have some questions from you guys that can give you an idea of if you got a full understanding of the problem. Now, the background on COVID-19 pandemic. Now, there are some issues that have to be considered when we talk about COVID-19 pandemic. First of all, the main features of government behavior during COVID-19 pandemics, because the problem is that whenever we look at how the governments have reacted to the COVID-19 pandemic, we can see that the behavior has been practically very similar across the range all around the world. First of all, we have seen government officers and even the general population who did not immediately sound the alarm. They didn't perceive that there was a danger coming to them. First of all, it happened in China, then Europe, the United States, South America. This is a serious problem. Second thing is that governments were sometimes reluctant to share information. We've seen it in news of today that even the World Health Organization is debating this thing of sharing information, and that has been a serious issue because, of course, many organizations have been reluctant to say what happened in their own countries. Many governments have done that, and the sharing of information, it has been a problem not only with the international health community, but also with their own people. Then another very serious problem is the official statistics. Official statistics are unreliable. Official statistics of those infected, of those who died. For instance, there is a big debate about the deaths at the nursing homes because the test, most of the times, the test for COVID-19 didn't take into consideration the deaths at nursing homes. And therefore, there have been some recalculations, for instance, in the United Kingdom about the number of deaths taking into consideration the deaths at the nursing homes. And also the impact, the economic impact, we're going to go through this. The economic impact has been a severe reduction of the annual real GDP growth, the total sales of goods and services, of the industrial production for the countries affected by the epidemic. So, in fact, what are the main health variables to be monitored now to avoid or to delay a potential second wave? Because the problem is that the second wave in pandemics is something very frequent, and the behavior of the population, of the governments, is essential to delay as much as they can the second wave. What variables we have to look at, and what blockchain applications can be used for these variables. First of all, we have to look at the identity, the moves, and the number of asymptomatic cases of COVID-19. Asymptomatic cases, we're going to see it, is a very important variable because these people are without symptoms, but they are able to infect other people. Then another important issue is self-isolation or mandated quarantine. And then we're going to see the testing for COVID-19 and the vaccine. Now, a recommendation is that the physical distancing measures should not be prematurely lifted. This is a serious issue because many countries are trying to do that, and therefore the countries that if they prematurely lift their physical distancing measures, that could lead to earlier secondary peak. This is a statement that was made by a top doctor from the London School of Hygiene and Tropical Medicines. And there are examples, we're going to see them, Japan, Singapore, even South Korea. These examples show us that the premature lifting of social distancing measures might be a danger. Now, to understand the problem, we have to understand what COVID-19 is and how it develops. If we look at this table, we can understand that. As we see, there is a period between the exposure and the transmission. Exposure is whenever a person gets the virus, starts a latent period. That means that we got the virus in, but we don't know it. Until there is an infection, the person is exposed to the virus, is incubating the virus, but doesn't have a sign of the virus. When it's infected, it still doesn't show that the virus is present until when there's a clinical disease. And then when it starts a clinical disease, there is a potential of transmission of the virus. And again, the incubation period and so forth, that happens for other people. So as you can see, the dynamics of the COVID-19 are very important for us to understand how this problem is developing. Now, let's start with the asymptomatic cases. This is a very important statistics. It's being shown, and is according to estimates, 80% of the people with COVID-19 have mild or asymptomatic disease. That means 80% of the people might not even show that they got the virus. Then 14% have severe disease, and only 6% are critically ill. So what does this mean? That means that a symptom-based control is unlikely to be sufficient for the control of the spread of COVID-19. Because if we check only the people that are symptomatic, we're talking about only 20% of the people that are exposed to the virus, while the other 80% is not considered. That's why they have a great potential, these are asymptomatic cases, of spreading the virus around. That's why we have to focus on the asymptomatic cases as well. And the use of blockchain applications to monitor the circulation of asymptomatic people is very important. That is why we're going to see that in a minute. Whenever there are discussions about asymptomatic cases, people focus on the blockchain application to monitor the circulation of asymptomatic people. Now, the problem is also the measures, the social distancing measures that are being taken. Because generally speaking, the governments have taken broader scale social distancing measures. Now, with the exception of some countries like Brazil, most of the countries have taken broader scale social distancing measures. What are they? They are stopping mass gatherings, closure of educational institutes, or even places of work, and isolation of households, towns, and cities. That has taken place first in Wuhan, then in Codogno in Italy, and then all around the world. What does a social distancing measure do? That measure, all of them altogether, cause a flattening of the epidemic curve. The epidemic curve flattens. And therefore, there is more time for the health services to treat cases and increase capacity. Because governments focus mostly on this issue, to have time to strengthen the health system and increase capacity, which means also masks, ventilators. We're going to see that. And these are most important issues. But there is a problem with that. What is the problem? The problem is the risk of a resurgence of the virus whenever containment measures are lifted to mitigate their economic impact. Because in what is called phase one, everybody pushes these social distancing measures, and then the governments are under pressure to lift these measures, and therefore there are some containment measures being lifted and the risk of a resurgence of the virus coming right away. Now, what happens is that there is a shortening of the time with these measures. There's a shortening of the time from symptom onset to isolation. That is vital because whenever there is as we've seen in this relationship between time periods, whenever there is a reduction of transmission, that is likely to slow down the spread of the epidemic. So the health organizations and the governments focus on reduce the transmission. And therefore they use targeted social distancing measures, especially for older people and people with underlying comorbidities. These are the people at risk more than any other category of people, and therefore they must be taken into consideration first. Therefore, there is an enhanced support for healthcare infrastructure, like, for example, in increasing intensive care beds and effective procedures for protecting staff from infection. Because the problem is that not only the older people, the people with the comorbidities can get the virus, but even the people, the people that work in healthcare organizations, the doctors, they are effectively exposed to the infection. And there is a need to use blockchain applications to monitor these processes. So the effectiveness of social distancing measures depends on whether infected individuals will self-isolate. Because if the infected people, especially the asymptomatic people, do not self-isolate, whenever we use any important measure, that is useless. Technology, as we're going to see, is not of any help if there is no participation from the people. They are essential for that. So how quickly symptomatic individuals take to isolate themselves is essential, because if people will be looking for medical advice by remote, unless symptoms are severe, that exposes the doctors, for instance, much less than if they go into emergency room right away and they infect everybody. So that's why it's so important. The individual behavior is crucial to control the spread of COVID-19. And there is a use of blockchain application to monitor these processes. But there is also an importance of the testing, because now it is essential to do widespread testing, contact tracing, and population behavior. These three variables are the most important measures with less disruptive social and economic impact than a total lockdown, because they can meaningfully control the spread of COVID-19. We've seen in the world that Hong Kong and Taiwan, for example, have been very effective in use a widespread testing. In Hong Kong, the effective reproductive number, what is called R0, the average number of people, each individual with the virus is likely to infect at any given moment has remained at approximately 1 in 8 weeks since early February to end of March. So this number is the most important number that all governments are looking, as we've seen in the relationship between time periods. If it's below 1 or approximately 1 is acceptable for governments. Then again, there is a use of blockchain to exchange information about tests in different countries, and that is essential. But also, it is essential, the vaccine. But unfortunately, any effective antiviral drug is unlikely to be available soon. There are two main issues at stake. First of all, where phase 3 trials will be done, where? Because the right location is essential, because it's where there is an ongoing transmission of the disease. So the phase 3 trial is the last trial that is done before the vaccine can be used, and that is that has to be used where there is an ongoing transmission of the disease. And also, who will manufacture the vaccine at scale? Because companies which are developing vaccine candidates should cooperate among themselves. So we've seen in France, for instance, there were some discussions about a large French company that was saying that they were giving some preference to United States because they put more money in it, and then they went back on that. But blockchain is useful to exchange information between medical centers and vaccine manufacturers about vaccine developments. Now, let's look at one thing which is very important, the economic growth after COVID-19. Because a study of the economic impact of the largest influenza pandemic in United States history, which is the 1918 flu Spanish pandemic, which lasted between from January 1918 to December 1920, and even spread worldwide, shows that a very interesting thing. The largest pandemic in history, in recent history, in the United States, showed there was a study done by Sergio Correa, Stephen Luck, and Emil Werner, that they analyzed the cities in the United States and divided those cities between two categories: the cities that implemented early and extensive non-pharmaceutical interventions, the lockdown, and the cities where there was early lifting of lockdown measures. Now, it is interesting to notice that the first categories of the cities, the one that implemented extensive lockdown measures, suffered no adverse economic effects over the medium term. So, in practical terms, they did better in economic terms than the cities that had the early lockdown, early lifting of lockdown measures. So they had a better economic performance and less deaths. So the first category of cities experienced a relative increase in real economic activity after the pandemic subsides compared with the second category of cities, in addition to a much lower number of deaths. So it's much better from the economic point of view, in addition to a health point of view, to have serious and extensive non-pharmaceutical interventions, lockdown measures, than to have early lifting of lockdown measures. And if we see this graph, there are 3 pandemic waves that happened in the period between 1918 and 1919 in the United Kingdom, and we can see that the first wave was small, but the second wave was terrible, was huge, and then there was a third wave. That's why we have to be very careful not to increase the number of deaths with the early lifting of lockdown measures. And now we go to blockchain solutions for COVID-19 outbreak. That is essential. Which are these solutions? Blockchain solutions are 4 main categories. The solutions aiming at tracking medical material supply chain and donation tracking, at managing medical data, contact tracing, i.e. the ability to find people who have been in close proximity to an infected individual, and insurance claims processing. Now we're gonna see lots of apps, lots of blockchain applications, but we're gonna focus on some specific ones because there are many. The first one that we're gonna see is an interesting one because it's not an application, but it's an ecosystem, and it's called Medlock. Medlock is an interesting application because, first of all, Medlock is a joint collaboration between a Dubai-based Avantas Technology Accelerator and Max Rowe, and is a monitoring, control, and communication ecosystem. You can see it from the graph. It's an ecosystem. i.e. it's an app to provide real-time COVID-19 insights to government agencies. Provides insights to government agencies in all the 3 phases of the pandemics. The first phase, as we know, is the response phase. Whenever there is a tracking supply chain for medical drugs, food, or other critical supplies, or coordinating welfare activities and tracking donations, and managing medical data. Second phase, the recovery phase, is whenever we have issuing of e-certificates to citizens about their COVID-19 status if they request it. So this app issues e-certificates to citizens whenever there is a consent, and that's very important because medical professionals can attest to a Medlock user status whom they have tested, vaccinated, or seen recover. So in that case, you can see that a user has a sort of certificate, can use it anywhere. Or collecting data to enforce smart lockdown strategies. This is another app within this ecosystem. And then there are some apps for the third phase, which is preparation for the next wave of COVID-19. And these apps focus on 3 main issues: helping law enforcement and border control authorities, advising media and citizens about with authentic information, and improving insurance claim processing. So Medlock, the main feature of Medlock is that provides COVID-19 information to government entities within the respect of privacy rules. Privacy rules are very important, but also Medlock has a trackable exchange of data between players for a smooth supply chain operations, because the issue of supply chain, as we're gonna see, is very important, and you have to keep track of the exchange of data, and that is being done with Medlock. And also, donors can see more clearly where their funds are going, because the issue of donors, as we're going to see later on, is a big issue, especially for China, and therefore you need an application that tells you where the money is going. Also, Medlock minimizes administrative costs through automation provides more accountability and public trust. And then there are some AI, artificial intelligence-based analytics and smart contracts which facilitate the coordination mechanism for welfare activities linked to the recovery phase. Because as we all know, the governments, whenever they are in the recovery phase, they are frantic to use measures, and sometimes they are not coordinated, and this app helps the governments to coordinate whatever they are doing. So this is the first application, actually the ecosystem. This is the most interesting ecosystem around for as a blockchain solution for COVID-19 outbreak. And then there are some others. There is a blockchain army, a Turkish blockchain company that created a contact tracing app called BCA ID. And then there is there are some others application. Now, Blockchain Army has got this application, this contact tracing app, that once it's downloaded by the user has got to sign up and answer a questionnaire checking his health conditions and whether he might have come across any coronavirus affected patient. Then, if needed, the patient, of course, if he's got in touch with the coronavirus infected patient, and if that is needed, of course, he can book an appointment via the app to test the coronavirus, and a specific app functions locates the test center where to do the test, and also allows to schedule the test. So this app is very good, not only tracing the people that are infected, but also booking for the test and also to locate where to do the test. Then there is another company, a Canadian company, that's called the Vital Hub Corp. That is, they announced in April the first deployment of a blockchain-based coronavirus screening app called the app Dossier. Dossier helps to screen residents for common COVID-19 symptoms. So if you have the COVID-19 symptoms, Dossier does the screening of that. Now, there are some applications that we have to focus on specifically for supply chain. Supply chain is one of the most important area of blockchain for blockchain application for COVID-19. And as we've seen it in the past, there were everywhere in the world critical issues of supply for health systems. First, for PPE, personal protective equipment, COVID-19, test kits, ventilators. So all these things were important, and therefore there was an issue of supply chain. What was the issue? Was an immediate surge in demand and the shortage of supply. There was a mismatch between demand and supply manufacturing. There were also some medical protectionist measures. For instance, United EU export certification was required for medical protective equipment. So, in fact, the EU producers couldn't export their staff, the medical staff abroad, because they had to get export certification from EU, and that requires 10-day delays, which probably leads to a drop in exports. And also some other countries adopted protectionist measures. So what are the blockchain applications for COVID-19? Now, these applications, let's start from, we're gonna go all around the world, but we start with China. We get Alipay. Alipay is a huge company in China. They, together with the Zhejiang Provincial Health Commission and the Department of Economics and Information Technology, Alipay launched a blockchain-based platform that allows users to track demand and supply chains and logistics of medical supply. So they track demand and supply of medical supplies. That means that the open blockchain network enables users to track the allocation of resources and ensures that their donations reach where it's needed. That is very important because most of the times there is a mismanagement of the donations. With this application, donations go where they are needed. There is the immutable ecosystem also records any mishandling of supplies, because that has been the biggest concern, the mishandling of supplies. Now we go to United States. We get the IBM. As we all know, IBM is launching IBM Rapid Supplier Connect Network, which is designed to provide support for supplier identity using blockchain technology. So they provide support for supplier identity. And the IBM network aims to help enable buyers in the United States and Canada, mainly the healthcare and government sectors, including hospitals, state procurement divisions, pharmacies, the state, local governments, to find supplies and services. So if there is a problem in mismatch of demand and supply for these categories, government sectors, hospitals, pharmacies, IBM intervenes with this network and finds a match between supplies and the demand. And also Northwell Health, the largest healthcare provider in the state, New York State, and the Worldwide Supply Chain Federation are two organizations that have joined the network so far. So as you can see, IBM has got a supply chain tracking solution, but still in the United States, we have another institution, which is called Rapid Medical Parts. This is a very new company. It's a stunning company, actually, because they work on a device called EVS4 that converts CPAP machines, which typically are used to treat sleep apnea, into ventilators to treat COVID-19 patients. This company was created in March 2020. It's based on a blockchain-powered platform for buying and selling traceable 3D printed parts, and was awarded by the Government of Defense a contract in only 12 days. This is amazing, only 12 days. But there's a big but, they are still waiting on approval from the Food and Drug Administration before they can start producing the device by mid-May 2020, which means approximately now. They are really waiting for the FDA to give them an answer. But also in the United States, we have another company, North Carolina-based Remedy, which is a healthcare blockchain company, and that is implementing a program, a supply chain tracking solution. Is implementing a program to improve supply chain monitoring and quality control while providing data for more targeted inventory. The aim is to improve access to medications by better tracking their movement on the blockchain ledger. In the past, Remedy created a blockchain-based program with the country of Mongolia, the World Bank, the Onam Foundation, to eradicate hepatitis C and track the movements of medications from manufacturers all the way to patients. So we can see the blockchain is really essential in the case of supply chain. But then we come to another category, which is donation tracking, which is quite close to supply chain, in a sense that donation, it's the same mechanism, but donation, you don't pay for the stuff, while in supply chain you pay, basically. There is a huge trust issue. Example is that given by China, because there the people's confidence in some state-backed charities organizations was severely damaged in the past. Why? Because there are online some videos of donated supplies being taken by non-medical personnel in China. So these people really didn't really need it, but they got it. Also, there was a Sichuan earthquake in 2008 in China, and the China Red Cross got a questionable reputation because there were some scandals linked to mismanagement of donations. But also recently, with the COVID-19 outbreak, the Red Cross Society of Hubei had some mismanagement, and they even stated they were deeply distressed. They blamed themselves and even felt guilty about problems with the distribution of donated materials. So the donation tracking is a blockchain company, the most important donation tracking blockchain company in China is it's called Hyperchain. It's a Hangzhou-based blockchain startup, Hyperchain, and they developed with China Xiong Group a donation tracking platform called Shenzong. Now, Shenzong is quite interesting because it tracks what kind of donations are given, from money and masks to medical materials, how they have been matched to areas of needs, and when they have been delivered. So it tracks what, how, and when the stuff goes to the people who need it. So donors who can actually see where the funds are most urgently needed, and therefore track their donations until they are provided with a verification that their donations have been received. So Shenzong guarantees via the blockchain the authenticity of donation information by putting it on the blockchain, which then cannot be changed or deleted. The donation recipients include some of the biggest hospitals in China, like Huai People Hospital, Shantao #1 People's Hospital in Hubei province, all of which have been treating people infected with coronavirus. Then another blockchain application is the one that is being used for managing medical data. In Xi'an, the northwest part of China, there is a province called the Shanxi province, and Xi'an is in this province, and they developed a system for online consultation, and screening was launched in February the 1st. The blockchain system securely manages health records and ensures what is mostly important: interoperability. This is a concept, a very new concept, a very important concept in blockchain. Interoperability means that with this blockchain, this blockchain is able to interact with different infrastructures at the same time without a need of course, there must be an upgrade in the systems, but it's basically, it fits the software systems very easily. There is no compromise of security and patient privacy as well. So this application of managing medical data is quite interesting. There is another blockchain application I've been looking at for quite some time, It's a blockchain-based open data hub called MIPASA. It's a platform created by the enterprise blockchain firm ISCEA and uses IBM blockchain platform and IBM cloud. Now, this is a quite interesting application, but we're going to see what the but is. First of all, it has very good sponsors. World Health Organization, IBM, Oracle, Microsoft, other tech companies, government agencies, the International Health Organization. They are all partnering in building MIPASA. MIPASA is designed to make it possible to a verified data hub synthesize data sources and address their inconsistencies. So basically, I've been looking at MIPASA myself. About a month ago, there were very few data. I looked at them again a couple of days ago. It was full of data. The database was quite interesting, just in a month. But what the but is that data are not very well explained. The database needs to be improved. If it's got such a big sponsors, I would expect, of course, it's a massive job to reconcile data from Czech Republic, from Italy, China, wherever. But it must be done. This work must be done for this application to be effective. And then we get to contact tracing. Contact tracing is quite an important application because government contact tracing apps are used in Asia and South Korea and Singapore, where Trace Together works by using Bluetooth to detect all the other users and the individual that have been in close proximity. But European GDPR rules, General Data Protection Regulation, are very important for contact tracing. In Europe, there's an application called actually a consortium called Pan-European Privacy Preserving Proximity Tracing, a consortium based in Switzerland, which wants to make a GDPR compliant opt-in location detecting app to expedite contact tracing for those who've been encountering coronavirus carriers. This app is being endorsed by the German Chancellor Angela Merkel. In Italy, Bending Spoon, which is part of the consortium, created Immuni, which is an app and endorsed also by the Italian government. Also in the UK, it's been testing an NHS app, and that remains subject to the European GDPR rules until the end of this year, when the transition period ends and following the Brexit. Now, there are some apps quite interesting in the United States, employer-focused contact tracing apps. The use of these apps could facilitate employees' return to work, but there are serious privacy concerns which must be considered to avoid possible lawsuits. Basic elements for employers to choose a contact tracing app are to understand how the product works, to make sure the employees understand how the product works, to use internal policies for the use of the app, to be compliant with the national or privacy rules. And then there is a point about the consent, the rule of consent, which is quite important. And it is for the consent for the rule is the following. The data subject has given consent to the processing of his or her personal data for one or more specific purposes. That means that if there is no consent, the app is illegal. It cannot be used. Consent of data means any freely given, specific, informed, and unambiguous indication of the data subject wishes that he wants to use the app. GDPR rules in Europe are very strict, and without this consent, the app cannot be working. And then there is a last category of insurance claims processing that I want to mention. The main issues of insurance claims processing are the following. Blockchain technology mitigates the risk of infection from face-to-face contact, as the platform is able to process transactions without human involvement. Now there is an app, a very interesting app, which is called, it's in China, being adopted, a mutual aid insurance platform called Xianghu Bao. And we're going to see that. This is a P2P platform. Now, the problem with the P2P platform is that they are largely unregulated, as they are not licensed by the China Banking and Insurance Regulation Commission. So they do not need to follow the tough capital requirements or other risk management rules like traditional insurers. But this app has been exploding in China. The Chinese blockchain-based collective claims sharing platform, Xianghu Bao, is Ant Financial's online mutual aid platform. Now, Xianghu Bao means mutual protection. The beauty about this app is that provides its participants with a basic health plan, which complements other premium health insurance offerings, but it requires no upfront payment. You pay nothing. No admission fee, processes coronavirus claims, and it's very cheap. I think it's about $10 per month or so. So when a participant makes a claim, the supporting evidence must be submitted via the Alipay app, and then it goes through a review and approval process. But being so cheap, it allows poor people in China to pay for the coronavirus treatment, which can cost from $5,000 to $10,000, just paying $10 a month. So you can see that this application is quite interesting. Now, we've been talking a lot, and now I would want you guys to give me your feedbacks and questions. I go a bit on the question side if there is any question. Otherwise, I would focus on some additional points that we've been covering. I don't see any question. So, because the time is finishing, to wrap up what we were saying, first of all, the blockchain is a technology. What does that mean? That means that to face the problems given by the COVID-19, there is no technology that can replace the human person. The behavior of the people is essential. Having said that, the technology can help us in dealing with the problems of given by COVID-19 with the efficiency. And blockchain is all about organization. So the organization of the supply chain, for instance, or the medical data, or the contact tracing, all these variables within the GDPR rules, for instance, General Data Protection Regulation of Europe, all these applications can work properly and beautifully if there is a behavior from the people behave in a correct way with the social distancing measures, with the measures that have been given by our governments. And also, we have to bear in mind that this is the general complaint that has been given, and we mentioned before that the economy suffers, is not true, in a sense that the people, in the long term, the regions, the cities that have performed better in the past are the ones that have been adopting stricter lockdown measures. And even in Italy, one of those regions like Veneto has been doing many tests and is been performing much better than another region next door, like Lombardy region, where there were lots of deaths. Because the approach is essential, but also the behavior of the people is essential for the technology to be effective. Now, having said that, we have to take into consideration also the side of donation tracking. As we've seen, there is a strong desire from the people to know how the money is spent, where the money is going, and when. So donation tracking is very important. Supply chain is even more important because governments have to intervene soon. They don't have time. How do they do that? They can do it if they have a blockchain that has got all in it. In the smart contracts, we've been defining all the main variables that needs to be supplied to the organizations that need it, like hospitals, like government agencies, state procurement divisions, and also there must be smart contracts for each category of medical supplies needed, like masks, like ventilators. So the blockchain must be effective, because there is no use of having a blockchain that doesn't cover all the main variables. So it has to be created in a proper way. Ideally, the ecosystem, in my opinion, is the best, because the ecosystem gives you several tools at the same time with just one counterparty. But there are some other actions that can be taken singularly also with the blockchain single apps. Just to wrap up, the blockchain solutions that we've been dealing with, as we said, tracking medical supplies, managing medical data, contact tracing, insurance claims processing. Now, I would say that we all have to anticipate the next wave. And as we've seen in this graph from the United Kingdom, we have to be very careful to be safe, acting with social distancing measures. Because, of course, the mortality rate might be very high indeed. We hope that that doesn't happen, of course, but we never know. The vaccine is a big issue, as we've seen it before, because it will take time. It will take 1 year, 1 year and a half, and I hope the big companies interact among themselves to create a good vaccine without thinking too much of the money, but thinking more of the people that they can help. And with this hope, I leave you all, hoping that you are all safe. Thank you very much.